Alrighty, we are coming up on the top of the hour, so we are going to go ahead and get started. Good afternoon, welcome. My name is Jared Barul. I am part of the Be Well team here in Virginia Beach. Before we get started on today's webinar, just a couple housekeeping items I'm sure you're all familiar with about a year into COVID world. This is going to be recorded. So in case you want to go back and look at anything or share with some of your coworkers, it is going to be recorded and up on our website shortly afterwards. As I would also like for you guys to all stay on mute. You've been doing a great job just while we've been waiting, so please continue to stay on mute throughout the presentation. If you need to speak or if you have any questions, please use the chat feature. I'll do my best to stay up to date on it and moderate. We will have a Q&A session towards the end, the last few minutes. But otherwise, we can go ahead and get it kicked off. Again, my name is Jared Barul, part of the Be Well team. We have a couple of our vendors as well as subject matter experts here to present for those of you that are expecting mothers or family members. So we have Optima Health, we have Virgin Pulse, Humana, and our own Consolidated Benefits Office members here to speak. So without further ado, we're going to go ahead and get started. Optima, you guys are up first, Miss Melanie and Tamika.
Hi, good afternoon. My name's Melanie Boyles, and I'm the manager of the Partners in Pregnancy team here at Optima Health. If you could go to the next slide, that'd be great. I wanted to give you a little bit of background on this program. We implemented this in 2003. The objective of the program was originally to decrease the number of babies that were being admitted into the neonatal intensive care unit. Now, since that time, the Partners in Pregnancy program has evolved to coaching and supporting Optima Health members to ensure healthy pregnancies. We also manage the incentive programs when we speak with members. Next slide. The team is comprised of patient service coordinators, care coordinators, and integrated case managers. The patient services coordinators will take low risk members, and by that I mean members who are having a normal pregnancy without any complications. The care coordinators will take members that are low risk and moderate risk. And by moderate risk, I mean folks that have possibly an underlying comorbidity such as hypertension, but they're not having any problems during the pregnancy due to that. The integrated case managers take moderate and high risk. So any member that is pregnant and has gestational diabetes or hypertension or any of the other possible underlying comorbidities, then those are automatically elevated to a nurse as soon as we find out about that, the underlying comorbidities. And usually those come out in an assessment that is done by all three levels. Next slide. Currently, this is all done telephonically. We have never really done face-to-face. So we do telephonic case management. We will coach them on healthy habits. We talk to them about the importance of making sure they're getting enough water and they're not being dehydrated because that can cause problems. We talk to them about getting enough exercise, what meals, what kind of meal planning they should do, making sure they're eating healthy diets. There's pregnancy and parenting education, and we will also refer them to community resources if there is a need. We do assess for any social determinants. So if there is someone who is having difficulty getting food or housing or transportation back and forth to their physician's offices, then we will also help them with that. Next slide. We have baby showers that are co-sponsored with Centera. Before the pandemic, they were being done at the Centera facilities, and the members would get a tour of the birthing centers that were associated with those facilities. Since September of 2020, we have gone virtual, and they have done GoPro videos so that they can actually still see the birthing centers and where they will be in, since no one is really going into you don't want folks going into the hospitals to do that now with what's going on with the pandemic. They also get a parenting magazine voucher that they can sign up for a parenting magazine. They have childbirth, breastfeeding, parenting classes. Those resources we can give them and help them with. And they also receive a Planning a Healthy Pregnancy handbook. Next slide, please. Some of the benefits, they have breast pumps can be mailed to the home, so they don't have to go pick that up. Members are referred to our vendor sites so that they can pick the one that will work the best for them, and then they are drop shipped to the member's home. We can set them up with lactation services. There are Pregnant Partners in Pregnancy information magnet that has our email address as well as our phone number. And there is also an incentive for participation that depends on the employer, but Virginia Beach does have one. So they need to speak with the member 4 times during the pregnancy, and the member has to complete a postpartum appointment. And then they get, I believe it's 3,200 points. Next slide. That's basically the layout of the program benefits, but I did want to let you know some of the success stories we have had. These 2 that I'm going to tell you about were both Virginia Beach members. The first one is a 31-year-old female. She was 24 weeks gestational age. She was on bed rest due to pregnancy complications, and we had someone talking with her, an RN speaking with her, provided education and support, and she delivered a healthy baby. And she did tell our ICM, she thanked her very much for the support. Her calls were something that she looked forward to. And being on bed rest, I think you can all imagine just how stressful that, sometimes being on bed rest is more stressful than actually getting up and moving around. Next slide, please. The next one is a 35-year-old female who was initially enrolled at 7 weeks gestational age. She reported having some stress due to her type 1 diabetes, and she had been previously managed with a medication that was non-formulary. The out-of-pocket, once we found out about it, the out-of-pocket cost to her was going to be $1,600. We did collaborate with her OB provider and her pharmacy department so that we could decrease her to $10 copayment during the pregnancy. This medication was something that was working well for her, and she didn't want to really change it during the pregnancy, and that's certainly understandable. But we did work with them. We got her a drug company discount, so she went from $1,600 out of pocket to $10 a month for this prescription. And her response to us was, "Thank you so much for your assistance today. I feel a lot better knowing that things are at least stable through June," which covers the pregnancy. Once she's outside of the pregnancy, then she will be able to she can either stay with that, or she can go with she and her provider can look for a formulary medication that will help her with her diabetes. And this, how to enroll, they can contact the Partners in Pregnancy, and this is their number. That's the number that will show up on the magnet that they will get. And the pregnancy partner at Centera.com is our email address, and that mailbox is monitored daily, and it's actually monitored by myself. Once I find out that someone is interested in the program, then I will respond to them, and then I will assign them to the appropriate person on the team.